Hi, my name is Anna. I'm a student physical therapist. Is it okay for you to be in this video and for it to be viewed by my teacher and fellow classmates?
Yes.
Okay. So I hear that you've come in and you're having some pretty severe right-sided jaw pain. That it's kind of interfering with your chewing and opening your mouth. I also hear that you just recently, in the last 5 weeks, have had a dentist appointment where you had a procedure done, as well as you also clench and grind your teeth at night a lot.
Yes.
Okay, so with that being said, I do believe that you, with these conditions that you're experiencing, this kind of fits well under our TMJ joint disorders. So that's temporomandibular joint. That's just a joint right in here. It does all of our jaw movements. So it's often, what that is, that disorder comes about, it's pretty common, especially after like a dentist appointment where your mouth is open for a really long time. It puts strain on the muscles of the joint with that, or people who clench or grind their teeth, I myself do it, that can also put a lot of pressure on that joint and cause a lot of stress on the muscles as well, and then that can cause this disorder to come about. So also with just stress in everyday life, we can often clench our teeth a lot and not realize it. That can lead to further issues with that. So that being said, this can last weeks to months depending on the severity of it, but you can also do specific things to help to relieve this and to help aid in this problem. So that's what we're going to work on today. One of the biggest things to be aware of is our posture. So I want to mention that first. So when you're sitting, if you have a job or anything that you sit a lot at or anything like that, you want to make sure that when you are sitting, because I know we do a lot of looking down at phones and stuff like that, we want to try to keep our neck straight, head on top of the shoulders rolled back and down. We can work on making the scapula, your shoulder blades, bringing them down and in, like you're tucking them into opposite pockets. Okay, so that helps, and then just trying to relax the jaw and relax those muscles around your neck. Okay, so another thing is having soft foods and not so much hard foods as of right now, and then right now trying not to open your mouth way too much, way too wide. Hot and cold compresses can be very helpful at this time, and a mouth guard for grinding is definitely recommended. Your dentist could talk to you about that more. So as far as what I want to teach you is, first I want to teach you, make sure we're doing it on time. I want to teach you the resting position of the tongue. This is going to help you to relax your jaw muscles and help to relieve the strain on that joint. So what you're going to do is, we don't want the teeth touching, we don't want the back molars to touch, so you'll have your mouth open slightly, lips still closed. You want your tongue to rest just behind your front teeth and just relax those muscles. How does that feel?
Feels good.
Okay, so we're going to add another component to this, and that's going to be nasal breathing, but we're going to use our diaphragm. So I'm going to explain how to do that. So you can place one hand on your stomach and one hand on your chest. And so you can maybe notice if you tend to have your chest rise more than your stomach with this. What we want is for our stomach to rise. So that means that your diaphragm, which is a muscle here, is moving down. Bless you. So we're going to take a breath in, and we're going to keep that relaxed jaw. We're going to keep the tongue at the roof of the mouth, just behind the teeth. How does that feel?
Good.
Okay, so we're going to add another component to this as well, and this is going to be controlled opening of the mouth. So you're going to keep that tongue at the roof of your mouth while you're doing this. I'm going to have you place your fingers on either side, here and here, just right here. And then you're going to slowly open your mouth, keeping that tongue at the roof of your mouth, and just relaxing those muscles and feeling for the symmetry on either side with your fingers. How's that feel?
Good.
We can keep it slow and controlled. Great.